about 7 a.m. I just got back from my morning walk with my dogs, and I have been considering what we need to do for this assignment. It is a video blog over a health disparity, and I have decided to go ahead and choose the opioid and prescription drug use and abuse in today's culture. I'm excited. Let's get started. It's Friday, and that gives me a week to work on this assignment. So, things I need to do: I need to find some people to interview who know about prescription drugs, who work in the field. I also just need to get some general opinions. I want to go for some younger opinions, see how it's addressed with today's youth, because I believe the youth is going to be what can help us combat these kinds of things. So, here goes nothing.
Okay, prescription drugs are regulated by making sure that the prescriptions we receive is from a valid doctor or hospital or office, and that the DEA of the doctor is present on the script. Also, the script cannot be more than 6 months old. In addition to that, the pharmacist looks on the patient profile and makes sure that the patient hasn't or isn't trying to pick up too early, or that they're not picking up at multiple locations at multiple times. So it's a lot that goes into that. But other than that, the opiate drugs are also kept in a time-delayed safe. And so it's the pharmacist is the only one who has access to that safe. So whenever, a technician needs it out, he has to be the one, or she has to be the one to get it out. So it's regulated that way too. Also with Walgreens, they have a good faith dispensing program where whenever a prescription is turned in, we then get the ID of the patient, and it is a form filled out saying if the patient meets these certain criteria according to Walgreens standards, is it okay for us to dispense it? And in that case, if it's not, then we don't dispense the medication. It's up to the pharmacist, because that's whose license it's going to be on. For Walgreens, we prevent prescription drug abuse by, again, not allowing the patient to get prescriptions more than 3 days early. And even if they do get it 3 days early, they can only do that 3 times, whether it's consecutively or throughout the year, because at this point you have 10 extra days worth of medication. But so keeping track of that. Also, Missouri has a tracking program where you can put in a patient's first and last name and their birth date, and it will track them all over Missouri. And it also has the same thing for Kansas. And if you have a Kansas license or Missouri license, you have access to both programs to see whether patients are going across the state borders to fill prescriptions, or if they're pharmacy shopping and going to different pharmacies. It shows other pharmacies, not just Walgreens chain. That's through Missouri. So that way, and then also just making sure we're keeping in contact with the doctor if something does seem a little sketchy. And then do I think that the opiate crisis can be something? I do believe that it can be, but I think it would take for the doctors to become very strict on what prescriptions that they're giving to patients, and not even what, but how much and how long the patient is on the medication, so that they don't become dependent on the medication. In addition to that, the doctors being strict enough to stop the medication and not to give prescriptions to the patients, and even if they are addicted to the medication, to then take necessary precautions to make sure that that patient is getting the treatment that they need to get off of the medication. But without the doctors taking those steps, it won't happen. It's going to have to start and end with the doctor.
I believe that the policies and the procedures that Larisha was talking about are definitely ethical, because they create a system in order to make sure that prescription drugs are regulated and that they aren't falling into the wrong hands and that people aren't abusing them.
My name is Terry Jenkins. I worked at Osawatomie State Hospital. I worked 2 years on the substance abuse unit. I worked there a total of 16 years.
Wow, that's amazing.
What was your experience with opioids and prescription drugs on the substance abuse unit?
My job was ward clerk, and the doctors would write the orders. Then I would take the orders off, which meant that I would make medicine cards for the nurses. So when they gave the medicine, they would have the information that they needed for each individual patient.
Interesting.
My experience on the substance abuse unit was that substance abuse users are very manipulative. They would go from one employee to another asking for an opioid, which we all were told no way. So that was my experience.
Interesting. Have you ever been prescribed an opioid type drug, and did you ever have difficulty getting off of the drugs?
I have fibromyalgia, and I was prescribed Lortab. I took it for many years, probably around 10 years. I had absolutely no problem getting off of it. When I was better, I had fentanyl patches. Had no problem stopping to use those. I'm just very lucky.
Absolutely.
I was someone who did not crave. I take Tylenol's the strongest medicine I take now for my fibromyalgia, and I have no problem, no craving for any kind of prescription medication. However, I did know a gentleman of my acquaintance who was prescribed Dilaudid for 2 weeks, and he craved it. He went back to the doctor for several months, and they finally said no.
They cut him off.
You should be healed by now. You shouldn't be having this kind of pain.
Yeah.
You're just going to have to deal with it.
Yeah, that's an extremely difficult thing to do, for sure. It's one of those things that can definitely happen to people, or else we wouldn't be having this opioid crisis that we are.
I'm in bed, hungover, because I went to a party last night. I'm of age. I'm 22. But at the party, something that I found interesting was not only was I offered Adderall twice, but I was also offered Ritalin. These are prescription drugs, and these are young people that are abusing them. And no, I did not take them. No, I will not say who offered me them. I just found it super interesting that it is so easily accessible for people our age to use and abuse prescription drugs that are not prescribed to them.
So what is DARE?
DARE stands for Drug Abuse Resistance Education.
And does it have anything dealing with prescription drugs?
It has an optional opioid crisis prevention education.
Interesting. Do you think that having an opioid prevention and education is important?
I think it's important for today's youth to know, or that knowledge is the first step to correct this problem in our country.
I can agree with that. Honestly, as an educator of today's youth, do you think that these kinds of programs are going to have any effect in the future, or will we be able to solve these problems?
Honestly, there's a lot that has to be done in order for that to happen. I had the DARE prevention program when I was in school, and I believe that that's part of what kept me from trying drugs as a teenager and even as an adult. But I also had that upbringing from my home, and so unless things change in the homes, unless laws are put into place that make it harder to get opioid drugs, doctors are more careful about prescribing these drugs, and we find a way to make it easier for unused drugs to be and we make it easier for unused drugs to be disposed of properly. I don't see the problem getting any better. In fact, I see it getting worse before it does get better.
Interesting. But do you think that knowledge is a crucial part?
Knowledge is definitely a crucial part. I mean, until you know something, you can't change anything.
Absolutely. Last question. Have you ever used or abused any opioid type drugs?
I have been prescribed some of those drugs after surgeries. I try to only use them for the minimal amount of time as necessary, and there have been times when I've not used them at all.
Interesting. Okay, thank you for your time today.
I think the biggest thing that I have learned this week is that prescription drugs and using and abusing opioids and prescription drugs has been something that has been happening for a while. There is definitely still a problem. We are trying to come up with ways to address the problem in the United States. I also feel like if we're going to come up with an answer, it needs to be multifaceted. It's going to have to encompass a lot of different things, such as policy and culture change, especially youth culture change, and just making it harder and more regulated. So this is something that our generation, especially as healthcare workers, is going to have to tackle. And I'm excited to see what happens in my lifetime. That's it. That's all I got for this.